Dr. Cohen-Mekelburg, can you tell us how this AGA CPU improves the care of patients hospitalized with inflammatory bowel disease?
Yes. So, as IBD care grows more complex and there's a rise in availability of novel treatments for IBD, we really have recognized that there's a gap in standardized guidance to support clinicians in providing high quality inpatient care. And so in the CPU, we are really interested in addressing this. We also provide a step-by-step checklist to make sure that inpatient teams can comprehensively address each of these aspects of inpatient IBD care that we find important. And so feel free to print these out and also use them in your own practice.
Perfect. I completely agree with all you said. I also found the structure of the CPU and best practice advice statements quite helpful in how we start with addressing indications for admission, initial management of hospitalized patients, evaluation for common complications, and suggestions for activity assessment during hospitalization.
I agree. Jana, can you share some of the key highlights on the management of inpatient ulcerative colitis treatment in our CPU?
Of course. In the CPU, we discussed the importance of timely exclusion for GI infections through stool testing and sigmoidoscopy, focus on nutritional therapy, early DVT prophylaxis, and timely initiation of therapy, be it medical and/or surgical. So Shirley, how about for Crohn's disease-related complications? Can you comment on that?
So in this CPU, we discussed the management of several Crohn's disease-related complications, including obstructions, abscesses, and perianal disease. For example, we discussed the importance of a multidisciplinary approach when managing patients with intra-abdominal abscesses. These include things like drainage if possible, systemic antibiotics, and options for medical and surgical therapy.
Perfect. Thank you, everyone, for joining us today for a discussion of this AGA CPU. We hope that this expert review is a useful guide to inpatient IBD care. Thank you so much.